Okay, have you ever heard of vaping? That's V as in victory, A-P-I-N-G, vaping, using those electronic nicotine devices. Today, a growing concern for parents is the number of young people who are now vaping. So joining me to discuss the risks that may come with vaping devices is one of my favorite people, Pfizer's Chief Medical Officer, Dr. Freda Lewis-Hall. So thank you for being here. Some people call them e-cigarettes, but what exactly is vaping? How does it work? And how long has it been around?
So they were first introduced about 12 years ago. And since then, the popularity has been growing, especially in teens and young adults.
Right.
Today, about 2 million middle and high school students in the US use these devices. These devices come in many forms and shapes. So it's e-cigarettes, it's vape pens, personal vaporizers. But what's common to them is that take a liquid, heat the liquid with a heating element, that turns the liquid into an aerosol or a vapor, and that aerosol is then inhaled into the lungs.
That can't be good.
Well, it's a variety of things that's in. Propylene glycol is one common substance, vegetable glycerin, as well as nicotine.
We have a video question from a young adult, 19-year-old Jonathan. He says that he has been using e-cigarettes since he was 16. Let's take a look at the question.
I've been vaping for 3 years now. I smoke every day, all the time, whenever I can. Could I be addicted? And also, is vaping dangerous to my health?
Well, Dr. Free, could he be addicted to this?
Yes, but let me take a step back and ask the question, what actually is an addiction? And according to the American Psychiatric Association, an addiction is when a person compulsively uses a substance, even when it causes problems for them, and they're fixated on its use to the point that it starts to take over their lives. So Jonathan said two things. First of all, he said all the time.
All the time.
Whenever I can.
Whenever I can.
So that waved a couple of flags there.
All right, so what are some of the potential health risks to young people who are vaping?
We know it's been proven that nicotine is a highly addictive substance, as well as linked to other health risks. Second, young people using any product that contains nicotine, there's a risk, and that is nicotine can interfere or harm normal brain development. And many people think that you stop developing your brain early, but we're still developing our brains into our mid-20s.
Right.
In addition to that, young people who use e-cigarettes may be more likely to go on to tobacco cigarettes. There's a recent study that found that amongst high school students, those that used e-cigarettes later went on to tobacco cigarettes at a rate 6 times greater than those who had not vaped.
Okay.
And so there are other things that may have potential health hazards. Like diacetyl, which has been linked to lung disease, or volatile organic compounds like benzene, or heavy metals like nickel and lead. So what I would say to Jonathan is, you have some health questions. The next best step is a trip to your doctor.
Now, our next video question is from Ashley. She says that she switched from cigarettes to vaping for the sake of her children. Take a look.
Look at Mom. I was a smoker for 9 years, and I was told it was safer around my children to vape, so I switched. And I'm wondering, is that actually safer around my children?
Oh, I love you.
What about children who are exposed to secondhand vapor? Is it safer than secondhand cigarette smoke?
Yep, so Ashley may have traded some health risks for another set of risks. For starters, e-cigarettes, the emissions don't contain smoke, but they do contain toxins that can be irritants to the eyes, to the skin, to the nasal passages, and cause respiratory difficulties. Research has told us that the emissions in the vapor or in the aerosol can actually expose infants and young children to aerosolized nicotine and other hazardous substances. The Surgeon General has concluded that e-cigarette emissions are not harmless. So the healthiest choice is keeping the air free of both smoke and aerosol vapors. Well, we saw her little one in the video.
Right.
So the cartridges or the pods contain the liquid. And if that's ingested, it can lead to acute toxicity and even death. So that's really important to remember if you've got little ones around like that.
Right. So Ashley, sorry to bear bad news, but vaping is not a guaranteed way to protect your children from potential health hazards.
I do want to add my congratulations to Ashley for taking these steps to try and protect her children for the sake of her children. So parents, teachers, and caregivers can set a good example by being tobacco-free. If you still use tobacco, quit, and there is help available. I would encourage Ashley and others to make sure that your children understand that exposure to nicotine-containing products is not safe, and they should not do it.
Well, I do want to give her credit for asking, trying to figure out the answers. And you can learn a whole lot more if you go to gethealthystayhealthy.com. I've said it many times, Robin and I love this site.
And of course, while you're there, you can sign up for our monthly newsletter.
Hopefully this has been educational for you. It certainly has for me. Thanks for talking about this.
No, I think it's important.
I want to thank all of my guests today, especially Dr. Freda Lewis-Hall.